Patients young and old filling up emergency rooms, urgent cares, and doctor's offices to start the new year with flu symptoms across the wiregrass.
For the past several weeks in the wiregrass, we have continued to see increasing cases of influenza.
According to the CDC, Alabama is seeing a very high amount of patients enter emergency rooms and doctor's offices with flu-like symptoms, such as fever, sore throat, runny nose, or cough. Some of those fevers lasting days at a time.
The longest fever I have seen this year from influenza was 15 days, and I have routinely seen kids with 5 or 6 days of fever from influenza.
Since the middle of the month, the state has almost a 6% rise in the amount of people walking into emergency rooms with symptoms, compared to just a 2% rise in December. That rush also leaving its mark on pediatricians' offices.
About 45% of the kids that we tested between January 10th and January 16th were positive for influenza. And that ended up being about 500 kids positive for flu just in our clinics alone.
And Dr. Ernest says that this is just the start of when they usually see the spike in flu cases, as it normally trends upwards in Alabama between January to March.
A lot of times when we get through this big wave in January, people start to let down their guard and think the influenza is gone, but it probably is not going to be gone until the end of March.
To treat the flu, doctors ask that people get plenty of rest and fluids while also maybe taking an antiviral, to go along with possibly setting up a date to get a flu vaccine.
It is never too late to get an influenza vaccine. Being vaccinated against the flu may not prevent every case of the flu, but it does greatly reduce their symptoms if they are unlucky enough to contract the flu.
Dr. Ernest says since the spike in her office a few weeks ago, cases of flu has gone down, but other respiratory illnesses like RSV and rhinovirus have slightly gone up. In Dothan, Aaron Dixon, WDHN News for the Wiregrass.